Right, welcome back. So in this video I'm going to be talking about an overactive thyroid or hyperthyroidism. I'm going to be talking about what causes it, what the treatment options are, and how massage may be able to help. But first of all, what is the thyroid gland? So the thyroid gland, you can see here in pink, basically sits around the trachea or windpipe, and it is responsible for secreting two hormones, thyroxine T4 and thyronine T3, which basically are controlled by the pituitary, which of course releases the thyroid stimulating hormone. So what is hyperthyroidism? Well, it's basically where that thyroid gland that you've just seen produces too much of each of the two thyroid hormones. So that's your T3 and T4. And what this means is that the person has an excessive amount of energy and a very fast metabolism. And I'm sure a lot of you are probably thinking, well, that sounds great. But actually it can really cause some, quite nasty side effects and symptoms. It can cause extreme weight loss, heart palpitations, very sparse menstrual periods, and also protruding eyes. Now, who is at risk of an overactive thyroid? Well, rather like an underactive thyroid, it's us women that are more at risk. So women are around 4 times more likely to develop an overactive thyroid than men, with approximately 1 in 50 women being diagnosed in the UK. People are generally diagnosed between 20 and 40 years old. And also, if a pregnant woman has an underactive thyroid, then an overcompensatory response in the baby can occur, which may result in them having an overactive thyroid. And so this is why, those blood tests during pregnancy that check for the thyroid levels are so important. Now, the causes of an overactive thyroid, well, there's 3 main causes. So, a thyroid infection, a toxic nodular goiter, which basically is where there are nodules that for whatever reason become hyperactive. Or there's something which a lot of you may have heard of called Graves' disease, which is basically where you have an autoimmune attack against the thyroid gland. And what this does is it causes excess secretion of those thyroid hormones. And Graves' disease accounts for about 70 to 80% of all hyperthyroid cases and will result in a goiter, which, if you don't know what a goiter is, so a goiter is where you get this rather noticeable swelling at the front of the neck, where basically the thyroid gland becomes inflamed. Now, the pituitary gland secretes thyroid stimulating hormone, otherwise known as TSH, and this basically controls the thyroid gland and the metabolic rate. But in Graves' disease, the thyroid does actually produce the TSH, the thyroid stimulating hormone, which of course is supposed to be produced by the pituitary. And the levels then drop, while levels of the thyroid stimulating immunoglobulins, or TSI, actually increase. So what happens is that these immunoglobulins, the antibodies, they then attack the thyroid gland, and this causes a 60 to 100% increase in the metabolic rate. So who is at risk for Graves' disease? Anyone, I mean, it can be genetic, as with a lot of things, but anyone who has undergone high stress levels, so it may be something like bereavement, can bring it about. Also exposure to x-rays, exposure of the thyroid glands to x-rays, and also previous use of antiviral medications, so things such as interferon or interleukin may also be responsible. And this basically results in symptoms such as the goiter, which you've just seen, which is that swelling in the neck, anxiety and irritability, insomnia, heart palpitations, unintentional weight loss, which we've mentioned, sensitivity to heat, increased perspiration, tremors, skeletal muscles, may weaken. There may be, a much lighter menstrual flow, dry skin, brittle nails, protrusion of the eyes, which is known as exophthalmos, pretibial myxedema, which is where you get raised red patches on the shins and the feet. There may be sensitivity to light or double vision. Probably one of the more serious symptoms is something called thyroid storms, and these are actually dangerous episodes of accelerated metabolism, which are usually accompanied by rapid heartbeat, fever without any infection, intolerance to heat, confusion, agitation, fainting, and general sort of symptoms of shock. And these really need immediate medical intervention. Now, treatment for an overactive thyroid really depends on what is causing it, but may include radioactive iodine. It can be used for diagnosis and to slowly deactivate part of the thyroid gland, meaning that the thyroxine levels will gradually be reduced and therefore symptoms will gradually be eased. This does, however, carry the risk of having an underactive thyroid after some time, but this is much more of a manageable condition. Other possible treatments are anti-thyroid medications, and of course not everyone with the radioactive iodine, not everyone can take iodine, so that may not be an option for some people. Anti-thyroid medications, which basically prevent excessive thyroxine secretion, or as probably more of a last resort if the iodine isn't an option, and if for whatever reason someone can't take the medication, then surgery is an option. You'd be looking at a thyroidectomy, which basically removal of the majority of the thyroid gland. However, this may cause damage to the vocal cords and also the laryngeal nerves and the parathyroid glands, which they basically control metabolism of calcium. It will, of course, also increase the risk greatly of hypothyroidism, or an underactive thyroid. But as we've already mentioned, an underactive thyroid is much more treatable than an overactive. Now, there are Obviously also things that you can do in terms of nutrition to help. So some foods such as bok choy, cauliflower, Brussels sprouts, broccoli, and also some fruits like peaches, strawberries, plums, pears, raspberries, and some vitamins as well will help to inhibit thyroid activity, but they really won't work if the immune system, is involved. So how can massage help with someone who has an overactive thyroid? Well, massage can help to suppress the sympathetic nerve system dominance, which will basically help promote relaxation and positive sleeping patterns, meaning that the hyperthyroid symptoms, which have these sympathetic-like characteristics, may be eased. Massage is also known for its effects on the immune system and improve lymphatic flow, which may assist if there has been any kind of thyroid infection. It can also help, obviously, with dry skin and maintaining muscle tone during that weight loss. But of course, it's not going to reverse the condition, and massage must be used alongside conventional treatment. So that's really an overview of hyperthyroidism. If you have any comments, feel free to leave them down below. You can message me through Facebook or Instagram with any questions. I'm on there as the Medical Massage Lady, and do subscribe to my channel. You'll be notified if any more videos come out. There's quite a few on there already on various medical conditions, sports injuries, and various health topics, so do take a look. And but for now, that's really all from me, so I will see you next time.